Welcome to the Hearing Center at Jacksonville Hearing and Balance Institute. Hearing aid technology has improved dramatically over the years. These advancements include rechargeability, Bluetooth compatibility, and remote programming, which is now available for most smartphones. We help you navigate the world of hearing aids to find the right device for your specific needs. After a thorough hearing test and medical evaluation, you will meet with an audiologist to discuss hearing aid options. Together, we'll explore which hearing device best suits your lifestyle. At your fitting appointment, we'll program the new hearing aids for your specific hearing loss, demonstrate how to take care of them, and answer any additional questions. The majority of new hearing aids allow us to offer you the option of remote programming with your audiologist for a virtual follow-up appointment in the comfort of your home or office. Simply download the manufacturer-specific app onto your smartphone. During your virtual appointment, your audiologist can make real-time changes to your hearing aid settings. You can provide feedback on sound quality and volume just as if you were in our office. This is a great option if you travel often, have transportation issues, or have difficulty leaving home. Patients tell us they love remote programming because it's so convenient.
Being an older patient, I am not technologically savvy. My audiologist thoroughly explained how to access the appointment. I was able to voice all of my concerns and questions, which were answered as if I was in the office. She was able to make an adjustment in my hearing aid and evaluate the change. I clearly was able to notice a difference right away. It's nice to know some things can be resolved this way.
Our goal is to help you reconnect with friends and family by improving your hearing with the latest technology. Call today to book an appointment and start your journey to better hearing.
Hello and welcome. It's exciting to welcome you to our first virtual seminar in connection with WJCT. And as you can see from the video, we're excited about some of the new technological advances that are available, and we'll be highlighting some of those new technological advances. And just a brief word about hearing loss. Hearing loss is one of those things that isolates, and unfortunately, in today's world with COVID and the isolation socially that comes with that, everyone is experiencing that to some degree. So hopefully you'll learn some new things about hearing loss and some of the new options that are available for you. And we're very excited about what we have to share with you today. You'll be hearing from a couple of our audiologists, Dr. Kelly Eaton, Dr. Ryan Funderburk, and also Mike Johnson, who's from ReSound GN, will also be joining us today. Before we get into some of those technological advances, I'd like to just kind of set the stage by talking a little bit about hearing. And hearing is one of those miraculous things that we take for granted until there's a problem with it. And it helps to understand how the ear normally works to be able to understand when there's a problem with it. Normally, when we hear a sound, that sound wave travels down our ear canal. The ear canal acts like a funnel, or the ear itself, the outer part of the ear acts like a funnel and funnels the sound into the ear canal. The sound waves then strike the eardrum, which vibrates in response to the sound. The vibrations then are passed along to the three hearing bones, the hammer, anvil, and stirrup bones. And the sound wave is then transferred into the fluid-filled cochlea. And within the fluid-filled cochlea are the delicate hair-like nerve endings that allow us to hear. And those hair-like nerve endings, once they're stimulated, carry an electric response to the brain that allows us to perceive the sound. And there could be problems at any stage of the process that causes hearing loss. Today we'll be focusing much of the talk on nerve-type hearing loss, which is the most common problem that we see. And I'd like to, without further ado, introduce Dr. Kelly Eaton. She's going to talk with us a little bit about hearing aids and some of the technological advances. And also in this seminar, we also want to kind of look back in the past. Hearing aids are one of those things where many of you may remember your great grandfather or great grandfather and some of the old timey hearing aids. And so we're going to kind of take a little step back in the past as well as talk about what's happening in the present and even look towards the future. So here's Kelly.
Hello, everybody. Thank you for joining us today. My name is Dr. Kelly Eaton, one of the clinical audiologists here at Jacksonville Hearing and Balance Institute. So I'm here to talk to you about hearing aids, past, present, and what we hope to see in the future. So to start off, what is a hearing aid? And a hearing aid is a small device that sits on or in your ear that helps you hear sounds you're no longer used to hearing, because the ear from the hearing loss is no longer able to detect those sounds or distinguish them clearly. Now, there's various styles of hearing aids available dependent on the shape of your ear canal, the type of hearing loss that you have, and your lifestyle needs. So that's something that the audiologist will go over with you at your appointment. And what does a hearing aid actually do? So a hearing aid is essentially a microphone and speaker system. So the hearing aid has small microphones on the device that will pick up the sounds in the environment that you're in. So the person you're speaking with, the television, a phone call. Those microphones then send the sound signal into the device where there's a tiny computer chip. This computer chip is then programmed specifically for your hearing loss to make that digital sound clearer for you so that you're better able to understand in those environments. That signal is then sent from the processing chip into the speaker. That speaker is the small piece again that sits inside your ear canal. And that signal then vibrates the eardrum and follows along the hearing mechanism that we had just discussed. Hearing aids of the past look nothing like the hearing aids of today, nor do they function the way the hearing aids of today do. We can see here this first image off to the left. This woman is holding something called an ear horn. Now, it funnels into the ear. The sound is picked up by the cone on the end of that horn, funnels down the tubing and into the ear canal. And this really just amplifies the sound a little bit. As technology has increased a little bit over time, we'll see this picture in the middle. The gentleman is wearing something called a body-worn hearing aid. Now, there's that small box inside the pocket of his vest. That is the actual hearing aid itself. There is a small wire that is attached to that, and that travels up through his vest, connected to a piece that is sitting by his ear, and that sends the signal into his ear canal as well. And this picture on the right, this is a typical hearing aid that was seen as technology progressed again in the late 80s and early 90s. And this is a completely ear level worn device. Now you do see it's pretty big. There is some tubing that comes down along the side. This was the most relevant type of hearing aid technology at the time that made sounds better to hear for the individual, as well as being discreet as well for them. So then when we get into the hearing aids today, off to the right here, you'll see that the hearing aids are rather small. Now this style of hearing aid is able to fit many types of hearing loss, from very mild hearing loss to a more significant hearing loss, as well as different shapes of hearing loss. Now there is something called a cross system. That is when somebody has hearing loss on one side or no hearing on that side, as well as a typical normally functioning ear or some hearing loss on the other side. So for example, your left ear may have very significant hearing loss and the right ear is doing okay. That transmitter device will sit on your left ear. The microphones on that device will pick up the sound signal, send it over to the better ear. Now this allows you to hear conversation and people from all around you, whereas you're not used to hearing that before. So rather than turning to hear with your better ear, you can converse normally. Hearing aids today are digitally programmable as well, which means they're specific for your hearing loss and your hearing needs. So we program the hearing aids designed specifically based off of the hearing test that you had recently done with your audiologist. And then they will also be programmable based on what you report. So if something doesn't sound right, or it's too loud or too soft, we can make those changes based on you and your environments. Now you do see they're very sleek, small, cosmetically appealing. Hearing aids, I'm sure you've heard people say in the past, They're very big, they're very clunky. They also whistle and squeal a lot. Hearing aid technology now enables us to have something called feedback cancellation, where it will detect if that feedback happens and get rid of it so that they're no longer obtrusive to your daily conversation. Hearing aids today are also smart, as I like to call them. So they are rechargeable, which helps alleviate the hassle of hearing aids if you have dexterity issues and can't use the batteries, if they're too small to manipulate, or if you can't physically put the device on. Rechargeability allows you to put it in a small charger. This will allow the hearing aid to charge overnight, and while it's charging, you're getting a restful night's sleep. When they're fully charged in the morning, you put them on and go about your day. Bluetooth capability is also something that is new and current in hearing aids. This allows us to connect to devices such as cell phones, TVs with an adapter, and what this does is allows you to have a clearer speech signal in those situations that you typically enjoy but have a harder time because of the hearing loss. So you can hear a cell phone call clearly because it's shaped for the curve of your hearing loss as well. You can also enjoy TV clearer with that Bluetooth signal coming directly from the TV adapter into your hearing aid so that you can have the TV clearly where you need it, and whoever you're watching with can also listen at a comfortable level. This Bluetooth technology has also led us to the most significant change in hearing aids, which is remote programming. So this remote programming allows us to make adjustments to your hearing aids with the convenience for you at home, in the comfort of your home, or if you're traveling abroad, and with your audiologist here in the office. Now, this is also especially important in current times like now, where there is health concerns that we want to keep everybody as safe as we can. So this allows our patients, and we've been doing this in our clinic recently, to stay safe and healthy, but still get the hearing health care that they need. So remote programming appointments enable a video phone call for you to be home and your audiologist to be at work. And you will talk and communicate about what you like, what you don't like, or what you need. And they can make real-time adjustments while you're on that phone call. Future technology as well is something called in-ear translation. So what this will do is the computer chip on the inside will also translate a language for you. So if you're on vacation in Italy and you don't speak Italian, it will clean up that speech signal so that you can hear it clearer, as well as translate it from Italian to English or whatever destination language that you select. They are also body-worn health monitors. So instead of wearing something like a Fitbit or an Apple Watch and having devices attached to every part, this is all in one. So it will notify you if your heart rate is a little high or low, if you need to get your steps in for the day, or any other physical exercise that it will monitor. And it will also alert about falling. So the hearing aids are able to detect if you have fallen to the ground, and it will set an alert via text message or phone call to whoever you designate that you have fallen, and then they can then contact you to see if you are okay, if you need assistance, and just get the help that you need. So it's an all-in-one. So it's a safety measure as well. Of course, we also look forward to seeing hearing aids get increasingly smaller and smaller so that nobody sees them, but also keeping the capability and technology that it has right now. So keeping everything as beneficial for you as we can to get you hearing the best that you can in your environments. And hearing aids today are not waterproof. They're more water resistant than they've ever been. But we look forward to them becoming more waterproof so that if there is ever the accident of jumping in the shower because you forgot they were on, they will be okay. So with that, we do have Mike Johnson here. He is from GN ReSound, one of the hearing aid manufacturers, and he's here to speak with us more about his product and how it is beneficial for you as the patient.
Greetings to everyone at home and watching virtually. It's a pleasure to be here. My name is Mike Johnson. I'm the territory manager for really all things going on in Florida. I get to work with your fabulous team up here in Jacksonville. It's really exciting to talk about technology today because I've been in the industry for 20 years. A long time ago, hearing aids just were amplifiers, and now they're computer chips that hang on your ear. It's tough not to turn this into a 2-day class because there's so much good stuff to talk about. But I want to spend just a couple of minutes highlighting some really key features that we see the audiologists really appreciate, and also that patients appreciate. Let's go. Before we dive into hearing aids, I want to spend just a minute talking about some of the things we're known for at ReSound. And really, I would say the number one thing is really the sound quality. When I work with audiologists, when I work with patients, it's really the sound quality that kind of comes into play. Going back even to 1988, some of the pioneering technologies that we've created are technologies that are really used by the entire industry now. First, to use wide dynamic range compression, which is the platform for all hearing aids. 1996, the first fully digital hearing aid. Again, that's the platform that all hearing aids use nowadays. Going back to 2010, we were the first hearing aid to use 2.4 gigahertz wireless technology. And even more currently, back in just a couple of years ago in 2017, again, another really pioneering technology that is unfortunately even more relevant today with some of the low contact and no contact needs due to COVID. And that's our remote fine tuning and the ability to use telehealth. So we've really, really done a nice job of creating some pioneering technologies for the hearing impaired. It's exciting. We're going to talk a little bit about wireless accessories, and that's going to be your TV streamers and those types of support devices. We're going to talk a little briefly on telehealth. We're also going to talk briefly on rechargeable hearing aids. But before we dive into that, it really starts with the hearing aid, which you can see a couple examples up on top. And when we think of sound processing, it really starts with the chip. The device that we're featuring now is called the ReSound Quattro. And this is a brand new chipset that gives us just light years of performance compared to other products that we see or even our previous products. And this is a bit of a diagram of kind of some sound processing algorithm, if you will. But I really want to highlight a couple basic things in this Quattro chipset. It's really all about the fast processor. Our processor, when you enter a dynamic room or even a quiet room, it's actually sampling the sound about 1,000 times per second so that it knows how to analyze, process, and produce the sound that's desirable to the patient. The other thing I want to highlight too is really the memory of the chip. And just like a computer, because hearing aids essentially are computers now, it's really the computer that runs the algorithms. And when we have a hearing aid computer chip, if you will, that has more memory, it's the memory that allows us to load more algorithms. And the algorithm is what's responsible for the sound processing. How does that hearing aid sound when you're in a quiet car versus when you enter in that loud Cracker Barrel after church on Sunday? That's the algorithm that processes that sound to make that sound clean, clear, not overwhelming, so you can hear those around you and really filter out the noise. In addition to that, because of the new chipset, we've really got some fantastic capabilities that are really second to none. A little technical, but on the input level, the sound that goes into the hearing aid, because of the chipset, we've got an industry-leading 116 dB input dynamic range. This is the largest input dynamic range in a hearing aid on the market. And really what this does in terms of what does that mean for the patient, this really means that for the patient, it's going to produce a really clean, distortion-free type sound. And when I get to work with patients, the first thing that I always notice that they say when we turn these devices on, it's almost every single time they say, wow, I didn't know hearing aids could sound like this. Or they say, it's been so long since I've had normal hearing. This is the closest I've ever heard to what I remember normal hearing being like. And that's just a great result. It's very exciting. The 9.5 kilohertz, this is really giving us the ability to do extended bandwidth. And why this is important is this allows us to capture additional high frequency cues. It's those high frequency cues that helps to encourage speech understanding and even localization because of high frequency cues that are picked up in the environment. That's the ability to confidently know where sounds are coming from. And last but not least, this high resolution due to the chipset really just provides just a clean, natural sound quality. Really the comment of, they don't sound like hearing aids. They really just sound like my hearing. And that's really what we want. Sound quality and performance and noise really are at the pioneering, kind of the front end of successful fitting. When we talk about accessories, the other thing that's really exciting that I really enjoy seeing is when we work with patients, we introduce them to accessories, things that you're seeing there at the top of the screen. To the left, we've got a couple different what's called multi-mics. And what this does is this allows for a hearing impaired person to wear the hearing aids, and then perhaps a spouse can wear this multi-mic. So it takes care of the classic, if you're down on the other side of the house, I can't hear you. This allows the spouse or a friend to wear a device, and as far as 80 feet, that patient or that person can speak and the patient will hear them. And it takes care of the kind of the classic, if you would just look at me, I would hear you better. This really takes it to the next level. In the middle there, we've got a TV streamer. So for anybody that's ever struggled with TV, this routes the audio from the TV directly into the hearing aids. It's absolutely phenomenal. It's full stereo. And then down below, we've got a picture of an iPhone. Again, first to market back a few years ago with actually pairing hearing aids with a smartphone or with an iPhone. And that has really, really enhanced a lot of new functionality, both in terms of the performance of the hearing aid, how you can adjust the sound and personalize the sound, but also how you can engage with your audiologist for telehealth. Speaking of telehealth, first to market really in the area of telehealth, and whether we like it or not, this may be the new norm, and it's really exciting that we have this. But we created a process called ReSound Assist to be able to do remote fine tuning, whether it be taking time off from work to go into the clinic, or if you're a snowbird, you have the ability now to get care and adjustments remotely. You can simply call your audiologist, talk about the adjustments you're looking for. Your audiologist can open up your fitting platform, make those adjustments, and send them to you. You download them with your smartphone. You can even use your smartphone and request an adjustment through your smartphone. That adjustment request is sent to your audiologist so that he or she can handle that, make the appropriate changes, and then send them to you. If you don't like them, you can undo it and do another request. And then more recently, we've come out with ReSound Assist Live. And this is kind of like a Skype call or a FaceTime call if you use an iPhone. ReSound Assist Live gives you the ability to see your patient, much like you're seeing me right now, and do a real live fitting remotely as if you were there in the clinic. And really, really cool technology. Last but not least, we're going to talk about really one of the things that's, I think, the most exciting. We've produced a really, really nice rechargeable system. Many would argue that they love our rechargeable system over a lot of options. But basically, you've got 3 hours charges the hearing aid. That gives you a full charge, and you can run around with those hearing aids on your ears for 30 hours. If you're streaming a lot through your iPhone, if you're streaming a lot through a TV streamer, you've still got 24 hours of use. You can stream a TV show or Netflix, binge watch your favorite Netflix show. You can watch that for 12 hours and still have plenty of juice. If you're in a crunch and you need to make sure that your hearing aids are fully charged, 1 hour on the charger gives you 16 hours of use, or even 30 minutes gives you an extra 8 hours of use. And so we've done a really nice job with a rechargeable solution. I do like that our charger pictured there has a case. It's portable. And you can even check on your phone the status of the battery, where the battery charges. On the inside of the lid, when you open it, you can see there on the left picture, there's some lights. The lights gives the patient a visual representation of how much battery life they have. That gives the patient confidence that they have enough power to get through the day. As well, on the left, you can see on the back of the charger, there's 3 green lights. Those 3 lights tells you how much juice or how much charge is in the actual case. That case is portable. So if you wanted to unplug that and take it with you when you travel, you have the ability to do that. That case provides you 90 hours of additional charge. So for example, if you were to wear your hearing aids today for 10 hours, you could later then put them in the charger. The charger refills those hearing aids up 10 hours, and that takes the charger from 90 hours down to 80. And that's day one. You can go from 80 down to 70, assuming 10 hours a day. And so you've got a lot of life in that charger, and it's portable. So if you wanted to take it with you on a trip, take it with you to go golfing with your buddies, et cetera, you've got that portability. I do like too that the rechargeable option that we provide also covers you in case you run out of power due to the things we get here in Florida called hurricanes. You're also covered in that regard. So again, it's easy to turn this into a 2-day class. I wanted to speak to you guys just for a few minutes on some of the really key features, some of the things that we've pioneered. Really, it all boils down to just really a brilliant sound. And so I'll basically close with that because hearing aids have gotten really good, and I think that's my time. So appreciate you guys listening. did turn.
All right, I'll just start with some housekeeping things. So for those asking about captions, unfortunately, we weren't able to get live captioning for this event. But once we post the recording, we hope to have that captioned. So hopefully, if you want to go back and rewatch if you missed anything, we'll have captioning for the recording. Also for questions, if you just want to hold off with the questions until the very end, we'll have a designated time to answer some of your questions. All right, so moving on to cochlear implants. So you heard in the previous two presentations how a lot of the technology is changing with hearing aids, hearing aid related technology, a lot of advancements as the world moves on. But for some, even the best hearing aids in the world are no longer appropriate for the amount of hearing loss that they have. And that's when we need to start looking at something else like a cochlear implant. So what is a cochlear implant? You may or may not be familiar. It's a surgically implanted device that has been FDA approved to treat more significant hearing losses. It consists of an external speech processor, as you can see in the image to the left, that black device, and then an internal implant, which you can see just to the right of that. There are 3 different cochlear implant manufacturers in the United States, and they all vary in multiple ways. But they're all going to have these 2 basic components, an internal implant that has to be surgically placed and an external speech processor that is actually picking up the sound. But how does it all work? So Dr. Green earlier mentioned how our natural hearing system works, and obviously nothing's going to be as good as the natural system, but the speech processor that you wear on the outside of your head, it has microphones just like a traditional hearing aid. But whereas a hearing aid will pick up that sound and send it down the ear canal, move the eardrum, use that whole natural pathway, now we're picking up the sound, converting it to a digital signal. It's being sent to the internal implant where it then stimulates the inner ear directly. So taking a step back to where Dr. Green mentioned the cochlea, our hearing organ, usually what's going to happen for a lot of patients is that those little hair cells are going to become severely damaged or even die out. And now we have an issue in the pathway where the sound can't get to the nerve like it once did. The idea behind the cochlear implant is we're now bypassing a lot of this system and directly stimulating that hearing nerve and sending a signal off to the brain. You can see in the image to the left an image of a speech processor that somebody is wearing and the relative size to their head, which you'll appreciate more as we take a big step back in time and look at the first speech processor. You can see this is a computer taking up an entire room. This is back in 1967. So a patient would actually have to sit down in front of this computer in order to get the signal sent to them. Obviously not very portable. They can't leave the house with it. As we slowly move forward in time, now we're looking at something a little bit more portable. You can see this gentleman has the speech processor over his shoulder. He can leave the house with it, have conversations, but still pretty large compared to what we have today. Finally, 2020, what kind of options are available? You can see this gentleman to the left has a speech processor that is almost completely covered by his relatively short hair. But not only that, if we talk about some of the wireless streaming capabilities, being able to take phone calls through your speech processor, similar to a lot of the hearing aid technologies that are available now. If you lose your speech processor, being able to use your phone or an iPad to locate the last place you were connected to it, using your phone or iPad as a remote control. And not just with iPhone, but there's a lot of Android connectivity options as well for cochlear implants and even hearing aids. But how do you know if you would be a good candidate for a cochlear implant? So traditionally, those with significant severe to profound hearing losses in both ears are ideal cochlear implant candidates. Let's start off by looking at this image to the right. or our audiogram. Some of you, if you've had hearing tests, you may be familiar with this. This is a way that we plot out someone's hearing loss. Across the top, we have frequency or pitch. So starting at the top left, we have very low pitches. As we move right, we have very high pitches. Looking at the left side, that's going to be our intensity level or volume. So the further down on the graph you go, the louder a sound has to be before you recognize it as being there at that particular frequency. So traditionally, a patient who would be a good candidate for a cochlear implant would fall into the yellow region or the yellow shading on that graph. That criteria has expanded over time. So now, for some insurance companies, you're able to get a cochlear implant if just one of your ears falls into that category, and you may have completely normal hearing in the other ear, or what we call an asymmetric hearing loss, where you have some hearing loss, maybe a mild, moderate hearing loss in one ear, but your other ear would be a good candidate for a cochlear implant. Probably the biggest thing is that traditional hearing aids are no longer providing sufficient benefit for you. Because as great as a cochlear implant can be, we always want to see if traditional amplification, traditional hearing aids are still a great option. A cochlear implant can do miraculous things for people, but it also requires a surgery, requires a lot of dedication and time on the part of the patient. So we always want to see if hearing aids are still a good option. Now, if we look back to the right at that graph, the area that represents the purple shading, or areas where the purple and yellow actually overlap, that is for a candidate to be a hybrid cochlear implant user. So a hybrid, just as the name suggests, is a combination of two things. In this case, it's a combination of a traditional hearing aid and a cochlear implant. You can see on the bottom image of that speech processor, now we have a little earpiece. That's actually going into the ear and amplifying some sounds, while other sounds are recognized by the speech processor and sent through the implant. This is truly a good option for people who maybe aren't completely cochlear implant candidates, but again, hearing aids just aren't providing enough benefit. Usually they're going to have fairly good and usable low frequency hearing, but then you see a steep drop off in the high frequencies, and those high frequencies are very necessary for speech understanding. So these may be people who their hearing aids that they amplify, they feel like they're getting enough sound, but their understanding is very, very poor still with traditional hearing aids. The cochlear implant process. So the first thing is always going to be having a traditional hearing test. Again, plotting out on that audiogram, where is the hearing loss? Is it mild? Is it moderate? Is it severe? Is it profound? And then sitting down with either Dr. Green or one of the physician assistants at Jacksonville Hearing and Balance Institute. And they'll make the decision whether or not you could possibly be a candidate for a cochlear implant. And if that's the case, they'll refer you to myself or another audiologist at Jacksonville Hearing and Balance Institute, and you'll have a cochlear implant evaluation. So this will be a little bit different than a traditional hearing test, because what we'll actually do is test you with hearing aids on to see how well do you perform with traditional hearing aids. And if we find that you meet certain criteria, that the hearing aids aren't providing enough for you anymore, that's when we'll say, all right, let's start to discuss a cochlear implant as a viable option for you. You'll get imaging studies done, so an MRI and a CT scan of the head to see if the appropriate anatomy and structures are there to accept a cochlear implant. I'm just going to move my video around a little bit. Oh, there we go. The surgery itself is an outpatient procedure. So barring a reason that you need to stay overnight, you'll go home that same day. The procedure itself is about 2 hours. And then it'll actually be 4 weeks before we turn on the device. So a bit of a healing period between, all right, you're having the surgery and you're getting the device turned on. After that, you have routine follow-ups every couple of weeks, every couple of months, again, getting the device to a comfortable place for you. But there's also things you're going to be doing at home, almost like physical therapy for your ears, where it's not like flipping a light switch where you get the cochlear implant and you're hearing better. There's work at home. You're going to practice with sentences and words, whether that's with computer software or a family member, wearing it consistently. All of these things will help you become a great cochlear implant user. Looking towards the future of cochlear implants, you can see images to the left. Those are actually current options, but with the future of cochlear implants, the processor on the outside is going to get smaller and smaller. The image to the left on top is from a company, Cochlear Americas. It's the device at Canzo. Down below from another company called Medel, called the Rondo 2. Now you're seeing that the processor can actually be off the ear and just sit over a magnet communicating with the internal implant. So these are current options. So you can already see the way things are going as far as getting smaller and smaller. They're becoming more waterproof, water resistant. Their wireless technology is getting better and better. And then hopefully one day in the future, maybe even a fully implantable device where you're utilizing that implant, but you maybe just have a microphone in the ear canal or some other option where you don't have to wear a speech processor on the outside. But exciting stuff in the coming up for cochlear implants. All right, I'm going to pass it over to Dr. Green, who's going to talk a little bit more about the medical side and surgical side of hearing.
Thank you very much, Ryan. I have the privilege of working with some excellent audiologists and physician assistants, and I think you all can see how having bright young people around you makes you better at what you do. So we're very fortunate to have some excellent audiologists and excellent physician assistants that make my job a little bit easier. So we want to take first off kind of a step back in the whole and take a look at ear surgery. Ear surgery is a fascinating area. It's an area with a very colorful history, and we'll get a chance, I think, to see some of that interesting history in the past. And let's step way back to start with to Hippocrates in 460 BC. Hippocrates, as many of you all know, was a very famous Greek physician. The Hippocratic Oath is one of the things that he said, but he also said this about ear infections. Acute pain of the ear with continued high fever is to be dreaded, for the patient may become delirious and die. And we don't think about that now with a lot of the childhood and adult ear infections that occur, but in the past, that was a very serious problem, and especially in the days before antibiotics, there were many patients who died from ear infections. I'm reminded there's a statement that I really like. It says that it's only because we're standing on the shoulders of giants that we're able to see further. And ear surgery is one of those areas where many giants have gone before us and have paved the way for us to do what we're able to do now. And this is from the 11th century. Bernard of Chartres was, I guess, the originator of that statement, but he used to compare us to dwarfs perched on the shoulders of giants. And because we're dwarfs standing on the shoulders of giants, we can see further than our predecessors, not because our vision is better or because we're taller, but because we're lifted up and borne aloft on their gigantic stature. So a beautiful statement, but very apropos to this whole area of ear surgery. So there are the middle photograph that you can see looks pretty brutal, but in the days in the 1500s, as I mentioned before, people were dying of ear infections, and infections would spread to the brain, and the patient would often die. And one of the things that the barbers, the surgeons of the day, noticed that oftentimes they would have swelling behind the ear. And this barber is taking care of that swelling behind the ear with a sharp knife in a very brutal fashion. And unfortunately, we've come a long way since that time. But patients do continue to get infections that will sometimes drain in the area behind the ear, as you see there. In the 1870s, a German surgeon, Hermann Schwartzy, you can see him pictured on the left with the long mustache and the beard, perfected what we call a mastoidectomy. The mastoid is a bone behind your ear. It's actually a honeycomb of air spaces, and those mastoid air spaces are what becomes infected typically when the infection spreads to the brain. And so he developed the current mastoidectomy that we do, and this became in most hospitals back in the early 1900s till the development of antibiotics, the most common surgical procedure performed. You can see over on the right-hand photograph a picture of what was called the mastoid club. This was during World War I and was a group of individuals that all had a bandage on their ear, having undergone a mastoid surgery, and it was and that was just a 1 day's work of mastoidectomy. So very, very common procedure in those days and life-saving at that point. As infections became better controlled through better surgical intervention and also through the use of antibiotics, it allowed surgeons to focus not just on the infectious part of ear problems, but also on hearing. And the first procedure to help with hearing was developed by a gentleman named Julius Lempert. He was a very colorful individual himself who lived in New York. He was of Jewish heritage, and although he was a brilliant man, was not admitted to an ear, nose, and throat residency because of his Jewish background. And so he went off and basically practiced in New York City away from general medicine and away from a lot of the well-known surgeons of the day, and developed this fenestration procedure that allowed people to hear. And it was an amazing thing, and really the first attempt to try to help people hear who had a particular type of hearing problem called otosclerosis. And he has since, Julius Lempert has since been recognized, and but a real pioneer and someone that all of us owe a great debt to because of his pioneering work. The fenestration operation was a big operation. It required the mastoid air cells, the mastoid bone, to be opened up into the ear canal. It was a big procedure. And in the early 50s, Dr. Samuel Rosen, also of New York, developed a way to allow the stirrup bone, which is frozen in place with otosclerosis, to be mobilized. It happened accidentally initially, and then there were all kinds of surgical procedures to try to purposefully allow the stirrup bone to be mobilized. And that was a big advance. And during one of those mobilization procedures, Dr. John Shea had figured out a way to develop an artificial stirrup bone. And he was in Memphis, Tennessee, and developed a procedure to actually remove the stirrup bone, stapedectomy, and replace it with an artificial bone. And that's very similar to the procedure that we do today, and has helped thousands and thousands and thousands of people, maybe even some of you that are listening through the webinar today. So exciting things that have happened to help with hearing. The cochlear implants, Ryan filled us in on some of the history and where we had been, and much of the history of cochlear implants is related to these two individuals. The smiling gentleman in the middle there is Dr. Graham Clark, an Australian surgeon who was motivated by his father. He worked in his father's pharmacy and as a boy, and was basically his father's ears. His father couldn't hear the people asking to have their their prescriptions filled, and so he would go get the proper medicine. And it motivated him to develop a way to help people with hearing problems. And he went on to develop what's called the multi-channel cochlear implant, which ultimately that developed into the Cochlear Corporation that Ryan was referring to a few minutes ago. And he's a great pioneer, a wonderful Christian man who has dedicated his life to helping people hear. On the right is my mentor, Dr. Bill House. Dr. House is an amazing individual. He's called the father of ear surgery and developed many surgical procedures that we do today, many of which we don't have the time to talk about today, but he was an amazing individual, originally trained as a dentist. He went on to get his medical training and then used a lot of the dental tools for ear surgery. And so a lot of that dentistry actually served him well later on. He was the individual that developed the first single channel cochlear implant and is credited for that. He did that amongst a tremendous amount of obstacles along the way. And his perseverance has benefited all of us. And he's an amazing individual in many ways. Unfortunately, he passed away a few years ago and just passed away actually penniless, even though he was a great surgeon, a great man. He literally poured every penny he had into trying to help people hear. So just an amazing individual, and I can't say enough good things about Bill House. Another surgery that we do frequently to help people hear is called a bone anchored hearing device. That's a device that goes into the bone and vibrates in response to the sound. And Dr. Tellstrom, who is from Sweden, developed this technology. It's the same technology that's used in dentures and dental implants, but it's used in the bone, typically behind the ear, to allow the sound to vibrate through. And another great innovation that we have. Let's step forward into the present, and some of these things have been mentioned, but I do want to expand on it a little bit. Cochlear implants have gotten better and better and better and better. And one of the exciting things that we have now is the ability to implant more and more individuals. And as Ryan mentioned before, not just people that are totally deaf, people that still have hearing, but that have difficulty with understanding. And so as the implants have gotten better, it's expanded the indications. And the hybrid cochlear implants, the part cochlear implant, part hearing aid is a big part of that. That's typically used primarily for people that still have low frequency hearing, but that have a very significant loss of high frequency hearing. Single-sided deafness is an area that we're very excited about. Individuals that suddenly lose their hearing for one reason or another can benefit significantly by that. It also benefits the ringing in the ear, the tinnitus that oftentimes accompanies that. And now more and more people that still have some hearing in one ear and a significant hearing loss in the other ear that have what we call asymmetric hearing loss. And these individuals are often able to wear a hearing aid in one ear and then the cochlear implant in the other ear. And they gain significant benefit in so doing. So the cochlear implants are very exciting, a tremendous area. But the whole area of ear surgery is kind of undergoing a big change. And the big change is in the area of endoscopes. An endoscope is a fiber optic device that goes into the ear, and it lets you see in a different way. The photograph at the bottom there is an endoscopic ear surgery, and you can see where there's no microscope that would traditionally have been used for the ear surgery. It's done with an endoscope, and it's almost as if your eyeball can go inside of the ear, and you can see in much greater detail all around. It's still in its infancy now, but does look like there's a great deal of enthusiasm for that. Some of the surgical procedures are done totally using an endoscope, as you can see in the photograph. And more commonly, many of us are using what we call endoscopically assisted surgery, where we'll use the endoscope in areas that are difficult to see, where we need to get to see around a corner or an area where we can't see in a direct line of sight. And so that's a very exciting area, and an area that will continue to move forward as time goes by. Some of you may have or be familiar with the Da Vinci system. It's a new robotic surgical system that is being used in many hospitals. They're doing lots and lots and lots of types of surgeries with the Da Vinci system. And that same technology, robotic surgery, is going to, at one point, help cochlear implants. One of the things about when we put an electrode array into the cochlea, we make a little tiny opening with a needle. It's a very tiny little opening in one of the areas of the cochlea called the round window. And then we insert that electrode array directly into that round window opening. Unfortunately, it's a blind move. You can't actually see where the electrode's going inside the cochlea. And the direction is one of those things where over time we know what direction to put it, but it turns out that with robotic insertions, and there's doing this in animals and primarily, it turns out you can do a more delicate insertion, and you can direct the pathway of the electrode array more precisely. So that is a very exciting area that we think will yield benefits for our patients in the future. It's now being used in the laboratory. Another area, and this is very apropos to what we're going to spend a few minutes talking about here shortly, is genetic testing. And there are many individuals, and some of whom are getting cochlear implants, who have a genetic hearing loss. And they're either born with that hearing loss or the hearing loss develops over time. And for years, we've struggled to understand the different genetic aspects of hearing loss. Now, as technology has been improved, as the human genome has been fully mapped, we're able to do these snippets of genetic testing looking for different things that would cause hearing loss. And there's a company called Otoscope by Dr. Smith out of the University of Iowa that currently tests for 152 genetic and microRNA abnormalities that cause hearing loss. And so I think, and you'll see why in a moment, that is going to be an extremely important area as we move forward with treatment of these genetic abnormalities. It's a little bit of a scary area. It's kind of a brave new world in this whole area of ear surgery, but I think the benefits are going to be just huge. And some of the preliminary research is exciting. Let's shift over to the future. The future, we talked about robotic assisted. I think that at some point, a lot of the procedures will be fully robotic. And that's kind of a mock-up of a robotic ear surgery procedure at the top. And a new type of device that is in limited use now is a new type of microscope device called the exoscope. And you can see that in the bottom right corner. This is a device that sends out a video image, extremely precise video image in 3 dimensions, and projects that video image onto a screen. And then the surgeon can look onto the screen and in 3 dimensions see what is going on. It does magnify the image like a microscope would do, and gives a very, very clear image. Unlike the endoscope, where you're actually putting something down inside the human body, this just looks over the shoulder of the surgeon. But that's a really exciting area as well. In the remaining minutes, I want to talk a little bit about gene therapy. And Gene therapy is, as I mentioned, the initial thing that needs to happen is to identify what the genetic abnormality is. And there are a couple of different ways that the genetic abnormality can be remedied. There's what's called gene augmentation therapy, where either a non-functioning gene is replaced with a functioning gene, or an absent gene is replaced, and that's called gene augmentation therapy. And there's also the ability to block certain bits of the DNA with inhibiting structures, inhibiting bits of DNA. And if you have a faulty piece of protein that's being formed inside the cochlea, you can block the formation of that abnormal substance, and that will, in many instances, remedy the problem as well. So a couple of different ways that it's done. And I'll just start off by thanking Dr. Mike McKenna. Dr. McKenna was a professor at Harvard who has retired as a full professor at Harvard and is now running a company called Acuos. Acuos means listen in Greek, and it is a company that in Boston that is going to be moving forward with some of these genetic therapy options, and he was kind enough to share some of his slides with me. The genetic information is actually introduced into the cochlea with a virus. Now, a virus is kind of a bad word these days, and we don't like to talk about that, but this is a manufactured virus that does not harm you. It's called an adeno-associated virus, and the DNA material is actually packaged inside this virus, and the virus deposits that DNA inside the cochlea when it's placed there. It's scary, but it works, and it's been used in many, many, many different areas. These are some of the adeno-associated virus gene therapy trials. There are 75 trials going on now. The most common areas, as you can see, are the eye and the brain, and these are using adeno-associated viruses, and they don't harm the individual when they're used in the proper way. This is actually how the adeno-associated virus with the needed reparative DNA is placed into the cochlea. The eardrum has been lifted forward. You can see the reflected edge of the eardrum. To the right of the photograph is the second hearing bone, the anvil, and below that is the stirrup bone. You can see the needle with what looks like a little balloon on the end of it. And that needle is actually how the DNA is inserted into the cochlea to allow this to be incorporated into the DNA of the cochlea. This is the delivery process. The little balloon-like area is placed into the round window, the same place we put the cochlear implant, and then the material is distributed throughout the cochlea and actually becomes part of the DNA of the cochlea. It's actually incorporated, and there's lots and lots of studies, primarily with primates, with monkeys, to show that this works very, very well. So it's very exciting technology that we have to offer at some point in the future. There are many, many different abnormalities that have been found within the cochlea that cause hearing loss. You can see in the little circles there some of the different abnormalities that have been shown to cause hearing loss. And these correspond to the left-hand side of the image. Some of these occur, in fact, the most common area is the outer hair cells and also the inner air cells to some degree. And those are the actual areas where the sound wave is picked up and received and modified. But there also are abnormalities in the different cells that are supportive cells around the hair cells. And they're equally as important, and abnormalities within those other cells can cause a multiplicity of different problems that can result in hearing loss. So many different things that can cause hearing loss. And theoretically, many of these are potential candidates for this type of genetic therapy. The first genetic treatment that will hopefully happen later this year is to replace a particular protein called otorphalin. Otorphalin, it's kind of a tongue twister, is a protein that transmits that is important in the cochlea in transmission of sound. And it allows, the otorphalin allows the sound to go from one cell to the next, from the hair cell here down to the receiving nerves that are called the dendrites. And when that doesn't work properly, then the patient develops the hearing loss that they have. And these trials hopefully will be happening later in the year through the Acuos company. And so hopefully many of you that are listening today will eventually be able to benefit from that type of technology. So to summarize, the surgery of the ear has an amazing and a very colorful past. It gives us the foundation for where we are currently in treating infectious problems and hearing loss. And one of the neat things that for me being in this field is the ability to offer hope to people. This is a time when people are scared, and I think they need hope. And it's exciting to see the hope that we can offer to people to communicate with their family members, with their loved ones, through cochlear implants, through hearing aids, and even through surgical intervention for the ear. And it's exciting. This future of gene therapy is literally in its infancy, but is really an exciting future for many of us in the coming days. So we want to open this up to questions, and I think there's a little area on the lower right-hand corner where you can type your questions in, and we'll be happy to answer them for you. Excuse me. I'm going to ask our staff to come up and join us, and then we can answer any questions that you may have about. We're still getting used to all this technology, so.
Here. We have some here.
Okay. So before we get too far into that, we are, one of the things we're trying to do, as we said, is to offer hope to our patients. And one of the things that's exciting is the hope that hearing aids and hearing aid technology can offer to our patients. So we are providing a discount to hearing aids through the summer months. We call that the Summer of Better Hearing. So any of you that are interested in taking advantage of that would be happy to have one of our audiologists speak with you about the hearing aid options. Okay, so let's start with one of the questions was is this appropriate for someone whose hearing loss is due to an acoustic neuroma? And that's a very good question. One of the areas that Acuos is targeting is patients that have acoustic neuromas that occur in both ears. It's called neurofibromatosis type 2. And it turns out that there is a medication that is used for neurofibromatosis type 2, and they're looking at ways to incorporate that into the DNA where the patients themselves, where their own cochlea would create a medicine that would treat the acoustic neuroma. It's still very early in its infancy, but it is an exciting thing that's potentially happening. So, but I don't think, so that may be helpful for people with a certain type of acoustic neuroma. Let's see. One of the questions is, where can I find additional information on which insurance companies cover cochlear implants for single-sided deafness? And maybe I'll let Dr. Funderburk address that question.
Yeah, so it's a good question because it is something that's relatively new. We've found that most private insurances are pretty good about covering single-sided. Really, you just need to worry about Medicare Medicare will not cover single-sided deafness cochlear implants, but we've had a lot of great success with private insurance companies. I also saw someone reference tinnitus and hearing aids, and there's a lot of great options out there. ReSound and other companies have designated tinnitus programs to help those that suffer from tinnitus, because it is very common in people with hearing loss to experience tinnitus, and that amplification just itself, and then also the different tinnitus therapies, can be really beneficial for those patients.
Maybe Dr. Eaton can talk about the tinnitus and some of the different.
Yes, so a lot, as Dr. Funderburk had said, a lot of hearing aids have technology and program within them to help distract the brain from the tinnitus. Now, we can't ever get rid of it completely, but there is a way that we can help sort of alleviate the effect that the tinnitus has on your daily life. So you would come into our clinic and we have a special appointment designated for tinnitus evaluations, where we will go over your type of tinnitus and evaluate what is the best option for you with that. Now, I do see a question here. Can a bi-cross hearing aid be updated to work with the telemed? So unfortunately, a hearing aid from 2013, this particular person is talking about, is not capable of that technology yet. It's really hearing aids that are within the last couple years. But certainly if anybody has current hearing aids that they are interested in doing telemedicine appointments, certainly give our office a call and we'll be able to look up that information for you. Let me see what other questions we have here. Somebody has a question about investigating gene therapy further.
Mm-hmm. Sure. So as far as gene therapy, it's really not something we're able to offer now. You can go to a website. It's called Acuos, A-K-U-O-U-S, Acuos, and you'll find out a lot of information. I don't know if those initial trials will be through the Massachusetts Eye and Ear Infirmary, which is a branch of Harvard. That would be my suspicion, but you could certainly keep your eye on that particular website and they'll be able to give you information on that. Let's see. Happy to answer other questions if you have them.
One about a high frequency challenged hearing loss in one ear and a non-operable ear in the other. What's our recommendation?
So it was on high frequency hearing loss in one ear,
And the other ear is non-operable.
A non-operable, probably a dead ear.
Mm-hmm.
So that would probably be a good, yeah, we'll let her talk about probably a bi-cross.
So that would be a system of hearing aids that we recommend, is called that bi-cross system. So if there's hearing loss in the one ear, no matter the degree, whether it's high frequency, mid-tones, and then the other ear is nothing really usable that we can correct, that bi-cross system is two pieces. You would wear a transmitter on your poor ear, that's a non-operable ear, and that will pick up the sound signal from that side and send it over to the ear that has the hearing loss. Now that ear is also getting correction for the hearing loss in that ear. So that really is the best option to give you the most realistic sense of hearing, so that you have hearing from both sides and correcting for that high frequency hearing loss in that one ear. Let's see what else we have here.
Someone earlier asked about Android connectivity. So I don't know if you want to talk about that.
So it sounds like there was a question on Android connectivity. So much like iPhone connectivity, for both the newer Android devices, kind of the genre of Samsung Galaxy S10 and newer, you also have the Android compatibility. And basically the iPhone and the Android, they're both now using kind of a native component in those phones that allows for a direct connection to the ReSound hearing aid, the Quattro hearing aid. So whether it be an iPhone or one of those compatible newer Android devices, you have the ability to stream phone calls and route any audio coming out of those phones directly into your hearing aids. So whether it be a Skype meeting, a webinar like you're joining us for now, a phone call, etc., you'd be able to route that audio into the hearing aids. About a year ago, it kind of made me laugh. I was helping with a fitting, and the gentleman definitely needed hearing aids, but he was actually more excited about the ability to stream Creedence Clearwater Revival through his hearing aids than he was really the improvement in his hearing. So that is definitely an option, and I have to tell you, they sound fantastic too. So hopefully that answers your question.
All right. See if
So, yeah, it looks like there's a question about connectivity in movie theaters. So I'm going to ask Dr. Eaton to talk with us about connectivity
Sure.
with movie theaters.
So oftentimes movie theaters will have something called a loop system where there is a digital signal that is picked up from the loop system and something in the hearing aid called a T-coil, also known as a telecoil. Now this telecoil communicates with the loop system so that that auditory signal from the movie is then sent directly to your hearing aids. All hearing aids, or most hearing aids, have this capability, and this is something that you want to make sure you express with your audiologist is important to you so that we get you the right device. Many patients also find that with simple hearing aid technology, just wearing their hearing aids on their own, they've heard better in the movies, so not even having the necessity for an extra piece or an extra system. So there are certainly many options that will make an improvement for that, but there is connectivity with that loop system as well for movie theaters. And yes, so a lot of times it also happens in churches or places of religious gathering, just to make sure that you can hear their service as well. So if that's something that you struggle with as well, certainly let the audiologist know at your appointment. This way we can give you the most natural sense of hearing and make sure that you get your world around you back to you. Okay.
So there was a question about noise-induced hearing loss from one of our patients. So Mike, maybe you can talk about noise-induced hearing loss and how ReSound handles the high-frequency hearing loss that's so common among hearing.
Noise-induced hearing loss is a common type of hearing loss. There's different versions and different, ways that can manifest hearing loss. But typically, a noise-induced hearing loss has a certain type of pattern. We'll often refer to it as a V notch, typically at 4,000 cycles, or kind of more towards the higher frequencies. It also can manifest in really just having a high-frequency hearing loss that just trails off. So what ends up happening is the patient will have often a lot of the lower frequency component, or think of the keys on a piano. You'll have the lower tone keys still functioning well, but those higher tone keys, or those areas where we get our speech clarity and understanding, those tend to trail off. So the patient will often be left feeling like they hear, but they don't understand. And that's one of the things I mentioned in my brief presentation, where we've got extended bandwidth. And that's why that's so important, is because that extended bandwidth actually will help to reach those areas where that high frequency loss is needing that amplification, if you will. So hopefully that answers your question. Anything else to add?
Not that I can think of.
Okay, I think we've got that covered.
Sure. Great.
That's really all I see for questions.
Yeah, I think we've gotten through most of the questions, and what I think we'd like to do is to go ahead and just encourage all of you to you can email your questions to us, and we'd be happy to try to answer them for you. I'd like to ask those of you that were that were able to participate and join us to fill out the questionnaire that will be sent to you by email, so that we can get some feedback. This is a new experience for us, putting on a seminar like this, and we'd like to get your feedback, and hopefully we can do more of this in the future, and that feedback will be very valuable to us. I'd like to thank our other presenters, Dr. Funderburk, Dr. Eaton, and thank Mike from ReSound for being with us today, and thank you for joining us. We appreciate you coming.
The gift card.
Oh yeah, please. Don't want to forget the gift card. When you do fill out your survey, they'll send you a gift card, and then you can have a nice lunch at Panera in the coming days. So that will be the kind of the ticket to get the lunch card. So
There's something I want to address. We had somebody else write in that they would like to schedule an appointment.
Okay. Yeah. So if you'd like to schedule an appointment, you could call our office, Jacksonville Hearing and Balance Institute. The number is 399-0350, and we have individuals would be happy to schedule an appointment for you. And thanks again for joining us, and appreciate you spending part of your day with us. Have a great day now.